Welcome to an in-depth look at dental caries, more commonly known as tooth decay or cavities. In this video, we'll explore what causes these pesky holes, how they develop, and what we can do to prevent and treat them. Get ready to dive into the world of dental health. So, what exactly causes dental caries? The main culprit is bacteria, specifically Streptococcus mutans, that thrive in our mouths. These bacteria feed on sugars and carbohydrates from the food we eat, producing acids as a byproduct. It's these acids that attack the tooth enamel, initiating the process of decay. Factors like poor oral hygiene, frequent snacking on sugary foods and drinks, and a lack of fluoride can all contribute to the development of caries. Let's delve into the pathophysiology of dental caries. The process starts with the formation of plaque, a sticky film that accumulates on our teeth. When we consume sugars, the bacteria in plaque produce acids, lowering the pH level on the tooth surface. This acidic environment causes demineralization, where the minerals in the enamel, primarily calcium and phosphate, start to dissolve. Over time, this demineralization weakens the enamel, leading to the formation of a small lesion, the beginning of a cavity. If left untreated, the decay progresses through the enamel, reaching the dentin, a softer layer underneath. Once in the dentin, the decay spreads more rapidly, eventually reaching the pulp, the innermost part of the tooth containing nerves and blood vessels. This can lead to inflammation, pain, and even infection. Dental caries is a global health problem affecting people of all ages and socioeconomic backgrounds. However, certain populations are at higher risk. Children and adolescents, particularly those from low-income families, tend to have a higher prevalence of caries due to dietary habits and limited access to dental care. Older adults are also susceptible, often due to receding gums, dry mouth, and pre-existing dental work. In general, populations with limited access to fluoridated water and dental services experience higher rates of dental caries. The signs and symptoms of dental caries can vary depending on the severity and location of the decay. Early-stage caries might not cause any noticeable symptoms. As the decay progresses, you might experience tooth sensitivity, especially to sweet, hot, or cold foods and drinks. Visible pits or holes in the teeth are a telltale sign. You might also experience toothache, either spontaneous or triggered by eating, as well as pain when biting down. In advanced stages, the pain can become severe, indicating that the pulp is inflamed or infected. Diagnosing dental caries typically involves a thorough clinical examination by a dentist. They will visually inspect your teeth for any signs of decay, using a dental probe to check for soft spots or pits. Dental rays are also essential for detecting caries in between teeth or under existing fillings. These X-rays help to reveal the extent of the decay and its proximity to the pulp. In some cases, advanced diagnostic tools like laser fluorescence can be used to detect early-stage caries that may not be visible to the naked eye. While not strictly classified into types in the same way as other diseases, dental caries are often described based on their location and severity. We have pit and fissure caries, which occur on the chewing surfaces of molars and premolars. Smooth surface caries develop on the sides of teeth, often between teeth. Root caries affect the exposed roots of teeth, common in older adults with receding gums. Based on severity, caries can be classified as incipient lesions, early stage, moderate lesions, extending into the dentin, and advanced lesions reaching the pulp. The treatment and management of dental caries depend on the stage and extent of the decay. Early-stage caries can sometimes be reversed with fluoride treatments, which help to remineralize the enamel. However, once a cavity has formed, it needs to be filled. The dentist will remove the decayed portion of the tooth and fill the space with a filling material, such as composite resin, amalgam, or gold. If the decay has reached the pulp, a root canal treatment may be necessary to remove the infected pulp, clean the root canals, and seal them to prevent further infection. In severe cases, if the tooth is beyond repair, extraction may be the only option. Prevention is key when it comes to dental caries. The cornerstone of prevention is good oral hygiene. This includes brushing your teeth at least twice a day with fluoride toothpaste, flossing daily to remove plaque and food particles from between teeth, and using an antimicrobial mouthwash. Limiting sugary foods and drinks, especially between meals, is crucial. Regular dental checkups and professional cleanings are also essential for detecting and treating caries early on. Fluoride treatments, either at the dental office or through fluoridated water, can strengthen enamel and make it more resistant to acid attacks. Dental sealants, thin plastic coatings applied to the chewing surfaces of molars, can protect these vulnerable areas from decay. The prognosis for dental caries is generally good with prompt and appropriate treatment. However, if left untreated, caries can lead to significant pain, infection, and tooth loss. Recent research has focused on developing new materials for fillings and root canal treatments that are more durable and biocompatible. Scientists are also exploring novel approaches to prevent caries, such as developing vaccines against Streptococcus mutans and using probiotics to promote a healthy oral microbiome. With ongoing research and advancements in dental technology, we can look forward to even better ways to prevent and manage dental caries in the future.